When we have talked about migraine, we often talk about migraine as a disorder on its own. But one of the things that can happen is that migraine can actually be one of the first symptoms of an underlying disorder. And this is the case of some of the rare monogenic vascular migraine syndromes. And one of these disorders is CADASIL. And what's important to realize with this is that migraine with aura can be one of the presenting symptoms of this disorder. So these patients often have migraine with aura, but these auras can be a bit atypical, so they can be difficult to spot, and sometimes it can be very challenging to differentiate them from a TIA, which is something that also happens in these patients. But it's still important that you realize that it's actually CADASIL what you're looking at, because patients with CADASIL require different treatment, different counseling, and especially when you do genetic testing, you need to discuss with the patients what the outcome will be and what that will mean for their families. So it's important that first that you realize that there's something more going on than just migraine, and that you do the additional follow-up that you need. It's of course depending on which disorder you're looking at. So for instance, we have another disorder called RVCL-S, which stands for retinal vasculopathy with cerebral leukoencephalopathy and systemic manifestation. And this disorder is known because it's not just neurological. It also has retinopathy, so disease of the eyes, and it's also a lot of the systemic manifestations such as kidney problems, liver disease, and a whole other scala of problems. And it's important to realize that when you have a migraine patient coming to your clinic who also has this kind of disorders, so the other associated disorders, that you think that there might be something more going on than just migraine. The same is said if they have a lot of family members who have migraine but also other things. So for instance, they might have a diagnosis of a lot of young onset strokes in their family, then it's time to keep thinking that it might be something more. Sometimes, unfortunately, the diagnosis is made de novo, so there are not any family members who also have the disorder, and then you can't trust the family because that won't help you.